Hi, welcome to Health Sector and Queerness. I am Rishma from Rangeen Khirki Foundation. We are a youth led feminist organization focusing on sexual and reproductive health and rights. We work with several marginalized communities, and it is through this work, in collaboration with multiple individuals as well as organizations, that we realized how most conversations around SRHR is extremely cis centric. There's also such limited conversation when it comes to the experiences of the community when they access SRHR in specific and healthcare services, both mental and physical in general. Accessing healthcare facilities, dealing with mental health, ensuring a safe space, all of this is often a challenge for queer trans individuals trying to live their lives true to their identities. The intention of this podcast is to be able to create spaces where these conversations can happen without the shame and stigma that the community already has to deal with based on their realities. In our podcast, we have the privilege of inviting amazing guests from diverse backgrounds who have been kind enough to talk to us about themselves, their experiences, and their lives. Join us in normalizing the conversation, making it mainstream, and passing on the mic. Hi, thank you so much for doing this, coming here and giving us your time. Before we get into the main issue at hand, here is a little bit about our guest today. Sasha is a 22-year-old from Bangalore. They are genderqueer and have been medically transitioning since 2019. When they are not doing their corporate day job, you can find them listening to BTS, watching queer-themed shows, cooking and painting. Hi, Sasha. Welcome. Thank you so much for your time.
Hi, thank you. Thank you for having me here.
Yeah, thanks. Let's get right into it. So from the time of your self-identification as queer, how has your approach to issues of healthcare and medical treatment changed, if at all?
I think ever since I started discovering my gender variance since I was a teenager, I've always hesitated to approach hospitals or just medical uh, establishments in general because they will definitely misgender me there. And I tried to not go as much as possible as until it becomes like a emergency situation, just because I really don't want to deal with that distress of trying to communicate my identity to them and then not understanding it. So I think I've just become very much more like reserved in terms of getting medical support.
Do you think that your identity or its perception and its impact on your interpersonal relationships has ever affected your mental health, Sasha?
Yeah, absolutely. When you're first figuring out yourself, your identity, you just feel like you're like the only person who has thoughts and feelings and identifies in that certain way. So I have been on this self-discovery journey since I was about 15 years old, and it's still continuing, and I don't think it'll ever stop. But coming out, it's never just a one-time thing. It's a repeated process that as you figure yourself out, you have to keep talking to people about how you're feeling or introducing yourself to newer people as you go through life and get older. So I have become a lot more reserved again in terms of interpersonal relationships. I try to limit how much I talk about myself to others in terms of my identity, especially when it comes to extended family members. So I refrain from meeting them as often as I used to before because they don't really understand or respect my identity, and it's very distressing, and it does take a toll on mental health because I see everybody else being very close and happy with their extended families, but I rarely ever meet them because I know that I'm going to be uncomfortable around them. It's not that they're unsupportive or they're hateful about it. It's just that there is no, they're not keen enough to learn more about my identity. So I just tend to like stay away. So it does bring me down and make me feel like, okay, I wish things were different. Um, but yeah, and if I talk about not people who are close to me and just like everyday people that I see here and I interact with, going about my day, I constantly have this thing in my head like, okay, how are they perceiving me? How am I presenting? What pronouns are they going to use for me? Should I change my clothes to look a certain way so that I fit in more socially? So it just makes me very, very like on edge and anxious the entire time that I'm outside the comfort of my home.
Yeah, I think I'm at a loss of words to express how brave you have been. And
Thank you. But I do think that being brave is not something that many of us choose to do. It's just something that we have to in order to go through life and survive it.
Absolutely. Yeah. Absolutely.
Yeah, it's
You said you have been transitioning for a few years. Have you ever had to go through mental health professionals or healthcare professionals who have been insensitive and transphobic? Because we know that it's difficult. It's difficult getting healthcare professionals who will listen to you and who will accept you. And I have had to go through my personal experience. I've had to go through therapists who have not been very kind with the crisis that I had been having. So what have been your experiences so far, if you want to share them with us?
Yeah, so prior to even transitioning, I have been seeking mental health help since I was like 13 years old due to various reasons. But I think the when I talk about psychologists or psychiatrists, my first interaction with them was around the age of 17. And at that time, I knew that I was, genderqueer, and that was kind of impacting my life at school because coming out to a bunch of close friends was all right, and they were like okay with it, and they were very supportive. But then word gets out, and rumors start to spread, and then I had to be like, yeah, you know what, you're right, I am queer. So what are you going to do about it? And there were a fair share of like people that I wasn't very close to who did uh, not take that very well and not treat me very kindly during school. So that really brought me down, and I needed some mental health help for that. So when I went and spoke to like one of the therapists that I saw, she was just very, very uneducated and uninformed about queer identities. So when I told her that I'm genderqueer and I go by these pronouns, I would really appreciate if you refer to me like this. She would just sort of, I don't know, gloss over it and not really take it seriously, and still continue to misgender me, which was quite distressing because she would also talk to my parents about me, like to report on progress and everything. And as it is, I was having a little bit of a difficult time making my parents understand what my identity is. And when your therapist doesn't refer to you correctly, it just makes it worse. So that was my first experience with a therapist who wasn't really outright transphobic, but rather uninformed and unwilling to learn more about it. But when I started transitioning in 2019, I had to meet a therapist and a psychiatrist in order to get on hormone therapy. So my therapist was thankfully very, very, very understanding and very gender affirming. But and even the psychiatrist was very, very kind about it too. But it was the doctor who prescribed me the hormones was very like strange and transphobic, although she says she has so many years of experience prescribing hormone therapy to a lot of trans people. I think it was one of her first times meeting someone who's genderqueer and not exactly a binary trans man or a trans woman. So I have very different goals when I say I'm transitioning. It's not that I want to get every surgery possible or look a certain way with the hormone therapy that you'd think a trans person would want. So when I tried to explain that to her, she was very unkind about it and trying to coax me into getting things I didn't want. So I stopped seeing her. But in the mental health front during transition, very, very grateful and lucky that the people that I saw were very kind about it.
Right. Thank you so much for sharing that with us, because it is an insight that I hope will help the people who are listening to this podcast, because that's been the objective of this podcast, to get information and get perspective out there. That is, I think, the major problem with regards to healthcare system and the queer community right now, the lack of information and the lack of healthy curiosity. I think it's just what is heteronormative is fine, otherwise it's not.
That's true. They are unwilling to learn about the expanse of identities out there. And I forgot to tell you about when I got my top surgery done last year. Was it last year? No, I think it's been 2 years.
Oh.
So yeah, when I got my top surgery done, the doctor was so, I don't know, she just kept referring to me by she, her pronouns and not really understanding why I wanted that surgery. And it just ended up being like not up to how I wanted it to go, the surgery. So now I need to deal with the necessity of saving more money to get it like a reconstructive surgery, because it didn't go well, because she had something else in mind and didn't really take my trans identity.
That must have been difficult for you.
Yeah, it is, because even now, like on a daily basis, I deal with like, you know, the discomfort of having the surgery that it didn't go as I wanted it to. And I'm just like waiting for the time where I can get it reconstructed, but that's another whole process and very time consuming, and I don't know, maybe next 2-3 years I won't be able to get it either. So yeah, that transphobic doctor has, I don't know, made me need reconstructive surgery now, so sucks.
We here hope that everything works out for you, and hopefully you don't have to go through insensitive, unkind people again in your journey, and it hopefully works out just the way you want.
Thank you everyone for joining us for this episode. Here's hoping that there will be more safe spaces
I have another
created
question. How
to
do
hear
you
and
think
ponder on these
demographic factors
experiences
like
and
class,
work towards the required
location,
changes in
religion,
the legal, educational and
all of
healthcare
these things, how do you
institutions.
think that
To know more
affects
about the
access to
work we
mental
do,
health
follow
services
us on
for queer or
Instagram,
trans
Twitter
people?
and LinkedIn. To hear the full podcast, subscribe to our channel on YouTube,
do not have
and we will meet
experience
you
of
next
facing
week
any
with more anecdotes, stories and
discrimination
experiences.
with regards to class or where I'm from, or any sort of demographic factors. But I do know people who have faced issues while trying to avail like medical or mental health services, because the people who they consult are already like, they've already a preconceived notion that okay, people who are from this background will be like this, and you know, that it doesn't go according to how they want it to, and sometimes they're unable to avail those services at all. So, but I can't really elaborate more on that because I do not have first-hand experience.
Right, that makes sense. That right. That's it from our side. Thank you so much, Sasha. It was wonderful talking to you. It's a great perspective to have. We got to know so much more. We really appreciate that you could make time for us and you could share your journey and your experience. And it's thank you so much. That's all we can say from the bottom of our hearts. Thank you so much.
Thank you to the both of you. And also, if I can just add that going forward in the medical or mental health space, I really do hope that there is more sensitization when doctors are getting trained to do what they're doing, and give them a more diverse education on the different identities there are and how they can be more respectful to people, because it really matters, you know, how you talk to a patient really matters, because they're here trusting you with, you know, all the information about themselves and things that they would like to get done through you. And if you're not respectful about it, then it becomes very difficult for the person. So yeah, I do hope that things are changing for the better.
Right, I think we had a conversation about this with some other guest also, like how education has to be restructured from the very basic primary stages in order for this to not persist through the layers of higher education and then when you become a doctor, the entire curriculum I think needs to get a queer lens, because the one that we currently have is not sustainable at all. It's not working.
Yeah.
Thank you everyone for joining us for this episode. Here's hoping that there will be more safe spaces created to hear and ponder on these experiences and work towards the required changes in the legal, educational, and healthcare institutions. To know more about the work we do, follow us on Instagram, Twitter, and LinkedIn. To hear the full podcast, subscribe to our channel on YouTube, and we will meet you next week with more anecdotes, stories, and experiences.